Diabetes is a health condition that many people live with today. It affects how your body uses sugar, which is its main source of energy. This sugar comes from the food we eat every day. When you have diabetes, your body might not make enough insulin. Insulin is a special helper, a hormone, that lets sugar go from your blood into your cells. Or, your body might not use the insulin it makes very well. This can lead to too much sugar staying in your blood. This can cause problems over a long period if it is not managed carefully with a good plan. Now, there is a newer medicine that can help some people with their diabetes. This medicine is called Mounjaro. It has been getting attention because it can be a useful tool. Mounjaro is designed to help adults who have type 2 diabetes. Type 2 diabetes is the most common kind of diabetes. It often develops in adults, but more young people are also getting it. Mounjaro works in a specific way to help control blood sugar levels. It is important to learn about any new medicine before you think about using it for your health. One important thing to know about Mounjaro is how you take it. Mounjaro is not a pill that you swallow like some other medicines. Instead, Mounjaro is an injectable medicine. This means it is given as a shot under the skin. Your doctor or a nurse will show you how to do this correctly. They will explain where on your body to give the shot. They will also tell you how often you need to take it. Using an injectable medicine might seem new or a bit scary at first for some people, but many find it becomes a simple part of their routine. So, what does Mounjaro actually do in your body? It helps your body in a few ways to lower your blood sugar. It works with your body's natural systems. For example, it can help your pancreas release more insulin when your blood sugar is high. It can also slow down how quickly food leaves your stomach. This can help you feel fuller for longer and can also help prevent big spikes in your blood sugar after you eat meals. These actions together help to bring blood sugar levels down towards a more normal range, which is very important for managing type 2 diabetes effectively. Mounjaro is specifically approved for adults who have type 2 diabetes. This is a very important point to understand clearly. In type 2 diabetes, the body either does not produce enough insulin or the body's cells do not respond properly to the insulin that is made. This is often called insulin resistance. Mounjaro helps to address these issues. It works by helping the body to use its own insulin more effectively and also helps to regulate appetite, which can be beneficial for managing weight, a common concern in type 2 diabetes. Doctors consider many factors before suggesting Mounjaro. It is crucial to understand that Mounjaro is not a treatment for people who have type 1 diabetes. Type 1 diabetes is a different condition from type 2 diabetes. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means people with type 1 diabetes make very little or no insulin at all. They must take insulin every day to live. Mounjaro works in ways that are not suitable for managing type 1 diabetes, and it could be harmful. The reason Mounjaro is not for type 1 diabetes is because of how the two conditions differ fundamentally. People with type 1 diabetes need to replace the insulin their body no longer makes. Mounjaro does not replace insulin in this way. Instead, it helps the body make more of its own insulin and use it better, which is helpful for type 2 diabetes, where some insulin production still exists. Using Mounjaro if you have type 1 diabetes would not address the core problem of lacking insulin and could lead to serious health complications. Always follow your doctor's guidance. Therefore, the distinction is very clear. Mounjaro is a tool in the toolkit for managing type 2 diabetes in adults. It is not a universal diabetes medicine. If you have been diagnosed with diabetes, your doctor will determine what type you have through tests. Based on this diagnosis, they will discuss the most appropriate treatment plan for your specific needs and your particular type of diabetes. This ensures you receive the safest and most effective care for your condition, helping you manage your health well for the long term. When you use Mounjaro, it is not meant to be the only thing you do to manage your diabetes. It works best when it is part of a bigger plan. This plan should always include a healthy diet. Eating well is very important for everyone, but it is especially vital when you have diabetes. This means choosing foods like fruits, vegetables, whole grains, and lean proteins. It also means limiting sugary drinks and foods that are high in unhealthy fats. Your doctor or a dietitian can help you create a meal plan that works for you and your diabetes management goals. Along with a healthy diet, regular exercise is also a key part of managing type 2 diabetes effectively. Physical activity helps your body use insulin better. It can also help you manage your weight, lower your blood pressure, and improve your overall heart health. You do not need to run a marathon. Even moderate exercise, like brisk walking for 30 minutes most days of the week, can make a big difference. Combining Mounjaro with good eating habits and regular physical activity will give you the best chance of controlling your blood sugar. There are some important health conditions to consider before starting Mounjaro. One of these is pancreatitis. Pancreatitis is an inflammation of the pancreas, which is an organ that plays a role in digestion and blood sugar control. It is not known for sure if Mounjaro is safe for people who have had pancreatitis in the past. There have been some reports of pancreatitis in people using similar medicines. Because of this uncertainty, it is very important to tell your doctor if you have ever had pancreatitis before they prescribe Mounjaro. Your doctor will carefully weigh the potential benefits of Mounjaro against any potential risks based on your personal medical history. If you have a history of pancreatitis, your doctor might suggest a different medication or monitor you very closely if they decide Mounjaro is appropriate for you. Always be open and honest with your healthcare provider about your full health background. This helps them make the safest and most effective treatment choices for you and your specific circumstances. Ensuring your well-being is the top priority in your diabetes care. Another important consideration is age. The safety and effectiveness of Mounjaro have not yet been established in children under the age of 18 years. Clinical trials for new medicines often focus on adults first. This is a common practice in drug development. Therefore, Mounjaro is not currently recommended for use in individuals who are younger than 18. If diabetes is a concern for a child or teenager, their doctor will discuss treatment options that have been studied and approved for their specific age group, ensuring their safety and well-being. Medicines are usually tested in adults before they are tested in younger populations for several reasons. Children's bodies are still developing, and they may process medications differently than adults do. It is essential to ensure a medicine is safe and works well in adults before conducting studies in pediatric populations. This careful approach helps protect children and ensures that any treatments they receive are appropriate for their stage of development. So, for now, Mounjaro is an option only for adults with type 2 diabetes, until more research is available for younger age groups. To sum up, Mounjaro is an injectable medicine that can be a helpful part of a treatment plan for adults with type 2 diabetes. It works by helping the body control blood sugar levels more effectively. It is important to remember that it is not for people with type 1 diabetes. There are also considerations for people with a history of pancreatitis, and it is not currently recommended for those under 18. These are all important factors to keep in mind if you are learning about this medication as a potential option for your diabetes care. The most important step you can take is to talk to your doctor or a healthcare provider. They know your health history and can give you the best advice. They can explain if Mounjaro is a good choice for you, considering your specific type of diabetes, other health conditions, and lifestyle. They can also answer any questions you have and discuss all the potential benefits and risks. Making informed decisions with your healthcare team is key to managing your diabetes well and living a healthy life. Always seek professional medical advice for your health.